Namaste and welcome to a very exclusive World Heart Day Facebook Live session. Today, we delve into the details of heart health with our eminent expert, Dr. Refai Showkathali, Senior Consultant, Interventional Cardiologist at Apollo Hospital's Greams Road, Chennai. Our expert will share insights on the topic such as recognizing heart diseases, the risk associated with it, maintaining heart health, latest innovations in heart treatments, and will address all your queries and concern. A very warm welcome to our Facebook Live session, Doctor.
Good afternoon, everyone. It's a great afternoon on a World Heart Day on the September 29th, 2023. It's a great pleasure to meet you all through this Facebook Live, and I think to understand how the heart functions and to improve your quality of life. I think the whole aim of doing today is to give more awareness to people like you out there, wanting to learn more and making sure that you change your habits, change your lifestyle, and to make your better health, quality of life for a long period of time.
So let's start with a very basic question, Doctor. What are the common signs of a heart problem that we as laymen should be aware in our daily lives?
So, when we talk about heart diseases, I think it's a wide spectrum of heart diseases you come across. So, what is the most common causes of heart problem? I think you all know that in India is the commonest problem with the heart is the coronary artery disease, which is the blockages in the blood vessels of the heart. But that's only one part of it. There's other different aspects of heart disease which many people are not aware of. So when you talk about heart, I know that it's only a 250 grams organ in your body, but actually it does the most job in your body as well. So to understand that the commonest symptoms you come across with heart disease or chest pain, the commonest thing, and then somebody being breathless, palpitations where you feel that your heart is racing forwards, racing fast, and then tiredness, and just when you feel you want to do more, but you can't do more than what you have to do in the past. And then you have like swelling in the legs, some giddiness, dizziness, where you feel that you want to walk faster, but you suddenly feel tired and just feel like you're going to fall down. So these are the commonest symptoms of heart disease. But of course, everything has got its long elongation of how you look at it, how you treat it, and all those things as well.
So, Doctor, today we see a lot of young people experience heart attacks or various heart conditions. Is this somewhere associated with COVID, or is it due to recent stress, or why are so many youngsters falling a prey to heart diseases?
I mean, see, the idea of people having heart disease is becoming more and more prevalent, particularly because we diagnose more heart problems. So those days, many people die, but none of them know that what did they die of. So if you look and ask people who died in their 70s and 80s, like 20 years ago, none of them didn't know exactly what is the cause because there is not awareness, there is no easy access to things like getting an ECG done. But clearly now we have access to many things very closely, particularly in cities like ours, where we can get ECG in 5-10 minutes. So awareness is increasing. So obviously any medical problems becomes more prominent when you are understanding the problem, you are getting aware of the problem. So similarly, I think so. But then again, you also need to understand that young heart attacks or the heart attacks in young people is also becoming more common for various factors. And that's your question is all about that. So if you look at it, the commonest being is the stress related to either physical or mental stress they go through, particularly in their workplace or in their family life, anything. There's a lot of things that can happen. So now you understand these youngsters, they have a lot of competitive mentality, and that's how we've been growing up kids from younger age. You need to be superior, you need to be active, you need to be the first one. So that puts a lot of pressure in them. And that building of these stresses over a period of time can reflect as heart disease. So imagine when you get stressed each time, you release a hormone like adrenaline. And this adrenaline is a good hormone. It's the fight and flight hormone, we call it as, where it's important for the body to accept that, and that hormone actually helps you to come out of the stress. But that is all in a context that if you have that in infrequent times. But when you have this released every few hours or few days so frequently, this can become more dangerous to your body than your protective effect of the hormone. And that is the recurrent stress which matters, and that reflects on your heart health in the long term period of time.
So, is it only stress, or are there other risk factors which could lead to heart diseases or a heart attack,
Yeah,
doctor?
I mean, when we talk about stress, stress is the most important point, but also other things like diet. So, the amount of diet, the different types of diet, and the amount of high saturated fat content in your diet also matters. The way you look after your body, like physical activity, your mental, physical, and it's like a combination of all these things that puts a pressure on the heart over a period of time. So the emotional factors, the stress factors, the physical factors, your diet, your lack of exercise, which is another important aspect in the context of our country particularly, because you cannot blame people for not being physically active. Particularly there are many things related to that. For example, there's not enough activities to do. There is enough sports activities or places that they can go to, or they can go for a walk. There's not a lot of things involved, but nevertheless, the most important thing is your mind to say that I want to do my own physical activity. I want to look after my body. I want to make sure that this is what I eat on a daily basis. I just make sure that I know what I'm talking about. That is one of the things we are talking about. Use heart, know heart. So you need to understand how your heart works and do that accordingly.
So, basically, which means during the day, do something but just keep moving.
Absolutely, I think that's the most important aspect. So the World Health Organization, not today, like 10 years ago, gave a very clear recommendation of how every human being should be. So the recommendation is you should do at least 150 minutes of moderate intensity activity, most days, over a period of week time. So if you do 5 to 6 days a week of 30 minutes is enough, as long as it's in a moderate intensity. So keep yourself moving. The sedentary lifestyle, which is another important aspect, particularly in youngsters working in different specialities, different field, IT industry, or different industries of that so corner, where you sit long period of time. So we call it sitting is the new smoking. Clearly, smoking has come down dramatically in many parts of the world, but this prolonged sitting is become taking the role of a smoking. So, what one would advise you to do is, if you are going to stay for longer in sitting in somewhere sedentary, make sure you keep moving your body every few hours to make sure that these are all taken care of.
Speaking of dietary practices, doctor, are there any specific dietary practices such as intermittent fasting or time restricted eating, keto, or there are many today? So, is there anything specific that you would advise which can keep our heart healthy?
So I think this is another important social media thing about different diets, how it helps your heart. Of course, there are millions of diets that's come across. Everybody comes out with a new dietary pattern. But what exactly is happening in cardiology or in heart health is something called Mediterranean diet. The only diet which has been proven to benefit your heart is the Mediterranean diet. So essentially, the European Society of Cardiology has given guidelines on what you to eat, what is it eat in moderation, what to be eat in preference, and what to be eat in a very little amount. So the concept of this Mediterranean diet eats a balanced of diet. So when you talk about balanced diet, it includes carbohydrates, which is the starch, and then you have protein and you have fat, and so it's not like we ask you to avoid fat completely. That the whole concept of fat is not allowed has been removed. So you also need some fat for your daily living. So we say more protein, few carbohydrates, and little more less some fats, and then a lot of vegetables and a lot of cereals and pulses and whole grains all included. So it's like a combination of things. All these other diets like keto or intermittent fasting has been proven to be beneficial for other things, but when it comes to heart health, there's no clear evidence for all these diets except for the Mediterranean or the balanced diet.
Doctor, we spoke about stress. Stress could induce blood pressure as well. So, is that something that we should be careful about? And how can we keep it in check?
Right. I mean, there are various ways. I mean, of course, we are all different human beings, have different ways of coming out of stress. We have our own ways over a period of time. When we are youngsters, you may be liking a hobby. You want to go and do some hobby when you're too stressed out. Some people just want to sleep it off. So different people have different ways of coming out of stress. I don't think there's any specific factors or specific way of coming out of stress. So I would suggest you, if you are somebody who has not been doing your hobbies, which you have been doing very when you're young, like playing some sports or watching something, please do that. But at the same time, you also understand what are the factors that increases your stress. So for example, if you are somebody who is into social media and always on the watch for something, and you get too stressed when you don't have time, so that should be avoided. So there are certain factors like how to avoid it and then how to come out of it. So if you take these two on balance, I think you should avoid sex. Some people may go for meditation, some people like doing yoga, some people wants to just sit and watch some nice TV program or some soaps. We don't know. It's entirely up to you. What is your personality? What is your way of coming out of stress? And make sure that you do that on a regular basis. Unwind yourself from a long day, stress day at work, and then you'll be fine.
Doctor, could you explain the impact of good quality sleep and an ideal duration which can improve or keep or maintain a good heart health? Are there any sleep disorders in particular that specifically affect the heart?
Yeah, I mean, so there are factors. So when we talk about generally in sleep, how much of hours a human being has to sleep? I mean, that again, that's also varies to different individuals. How you've been brought up, how you've been trained your body to be like. But in general, there are studies which show that if you sleep for 6 to 8 hours a day, it's actually an ideal form of thing. So people who have less hours of sleep or compared to people who have a long like a normal hours of sleep like 6 to 8 hours, and also people have longer hours of sleep. Interestingly, this is a research study which was published in European Heart Journal a few years ago, suggesting that in the long run people who sleep between 6 to 8 hours have a lesser chances of having heart attack and stroke. There are people who sleep less than 6 hours can have a little higher chances of stroke. Interestingly, they also say that if you sleep longer, if you sleep more than 8 hours, your risk of stroke and heart attack is also going high. So you need to be having a balance of this. Doesn't mean that if you sleep longer, you feel better. I think that idea should also come out, but at the same time, you should not sleep less amount of time. Coming to, is there any specific sleep disorder which can cause heart disease? Yes, in general. Then we also know that this obstructive sleep apnea, or there are conditions where you feel like you're sleeping, but actually you're not having a proper sleep. And it's well known fact that obstructive sleep apnea is a very common condition which has not been diagnosed by many people, and it can lead to heart diseases in the long run. So these are things we need to be aware of and understand that if you have a problem, that if you couldn't get a good sleep at night, but if you start falling asleep particularly during daytime multiple times, then you need to see a doctor to assess for that and then decide what to do for that.
Doctor, is heart health different in men and women?
Wow.
And given that women go through a lot of hormonal changes during their lifetime, and women tend to stress a little more when compared to
Absolutely.
men. So does it differentiate between men and women?
Yeah, see, I think we all know from different studies and data that women are to some extent protected from heart diseases, particularly this coronary disease, until a period of their menopause. And that's because of their hormonal estrogen, which secretes. And the idea of estrogen does help prevent clogging of blood vessels. You can always say that, or it increases your flexibility of the blood vessels. So therefore, the chances of plaque building inside the blood vessels are lesser. And so that way, the researchers over the years have shown that women are protected from this coronary artery disease to some extent up to a certain age. But that is what we've been learned when you're in medical school, when you're in when you're post graduation. But what we see is a different type of pattern now. We see that the whole changing pattern of hormonal imbalance, the women doing more work, physical activity, everything, their chances of having heart disease is also going up. And the most important factor is also their stress. Though women take stress a little longer, maybe, then studies have clearly shown that they have take stress longer than men when it comes to any specific triggers. And when you have these kind of triggers happening so frequently, your chances of heart diseases are much more common in women, particularly even in those like a few years ago, we never seen women at young age 40s having a heart attack, but we do see patients coming with heart attack at 40s because they have been going through long working hours, stress at work, stress at home, a lot of things that happen, and their dietary pattern as well. So again, it comes to how the dietary pattern also behaves on the human body. But I think the most important point is women also have other heart problems. And apart from the coronary artery disease, they do have a stress specific heart disease, such as like cardiomyopathy. When they have a pregnancy, there's a small chance that the heart gets become enlarged and the heart pumping gets weaker. This is the postpartum or peripartum cardiomyopathy, we call it as. They also have this broken heart syndrome, which is called the stress cardiomyopathy, where they don't have any major problem, but a single point of stress make their heart goes weak and then suddenly become breathless. And but thankfully it's a reversible condition. If you identify early and get the treatment early, things can get better.
Which was my next question to you, that what are the warning signs that are specific to women or specific to men? Do they change when compared to both of them?
Yeah, I mean, the way we discuss about this is, if I want to say, in terms of coronary or blood vessel blockages, women symptoms comes in a slightly different way than men. So, for example, if somebody comes with a heart attack, particularly in men, usually not 100%, it's probably because they have a heaviness in the chest, sweating, palpitations, and they feel like they're going to fall, like, collapse or something. But in women, they present differently. Not always they have this typical symptoms of chest tightness in the front of the chest. Sometimes they present with back pain, so they think it's actually something different, thinking that they don't have any pain in the front of the chest, but they have back pain. Of course, that is something we need to seriously taken into. Sometimes they have pain in the just on the left arm, they don't have any pain in the chest. Sometimes they just have profuse sweating, no chest pain. Sometimes they have just slight pain in the throat or the jaw, but no chest pain. So these are symptoms, particularly when they are diabetic. Women with diabetes very present very differently to everybody else when it comes to coronary artery disease. But in general, if you aren't asked about cardiomyopathies or where your heart pumping is weak, it's the breathlessness. So it's breathlessness, tiredness, weakness. This is the same thing. The easy fatigability. They feel fatigued so quickly. These are the symptoms of. But when it comes to coronary artery disease, they definitely present slightly different to men.
Doctor, a very popular acronym going around the internet right now is something called the heart age.
Yeah.
How do we assess and improve our heart age, doctor?
So Heart Age is actually a calculator. It's a web-based calculator provided by different group of organization, including the Heart Foundation and the National Health Service from UK. So there are different sort of calculators available on online. You can go through. But what you need to understand is, particularly when you put all the details, a lot of information will ask for you to provide them with your age, your family history, your smoking habits, your blood pressure. Most of the time it comes out that your heart age is slightly higher than your normal age. That's a very common thing. So it's not been validated in large studies, but it just gives you an idea of how your heart is. So I don't think don't get glued up into that, and don't get too stressed about when you see, like, you're 40 and your heart health comes as 50. That's reasonably common. I think it's very, very rare you to see some people have a younger heart age than what we normally are.
We'll take some questions from our viewers, doctor. My mother has diabetes. How can it affect her heart, and what can she do to minimize the risk?
So diabetes is one of the commonest reasons for coronary artery disease all over the world, and we know that India is actually the diabetes capital of the world. In 2020, we're probably going to have a lot of diabetic patients around, and one of the important risk factors for heart disease is diabetes. So if you are having, your mother is diabetic, of course you need to make sure that she gets checked her sugar levels on a routine basis, she gets her cholesterol levels on a routine basis, she gets her ECG, an echo, and a treadmill test if possible. These are the standard things to assess your heart, particularly if you're a diabetic. And if you have any suspicion in that, then you can go to the next level of test, such as a CT, coronary angiography, or an angiogram, where we do a procedure through under the wrist. So any of these can be done. So diabetes is a strong risk factor. So if you're a diabetic, you need to be extra cautious to identify symptoms, because again, patients with diabetes don't present typical with like what other person presents with.
My niece is just 22 years old and she experienced a heart stroke. Could you explain the factors that led to such an occurrence while she's so young, and what measures can be taken to prevent it in the future?
Very interesting. I think what you need to understand is heart stroke is a little little terminology which many people cannot identify as a medical professional is because stroke is a word we normally use for something like a weakness of the one side of the body, whereas a heart attack is something to do with the heart. So, as a 22-year-old with something like what we sounds like some minimal stroke, it could be a blood vessels or anything small clot going up the brain, affecting her one side of the of the right arm or right leg. So these are things that she needs to be evaluated properly by doing ECGs and echoes and probably a Holter monitor to see if there is anything irregular heartbeats happening, which can be identified. And as an individual case, we cannot say until we have all these reports in front of us and discuss about it.
My cousin was diagnosed with a heart condition. Should I also get a heart checkup done, even if I think I feel fine?
Yeah, so essentially what you're trying to talk about is the genetic impact on heart diseases, so genetic factors. So for example, if your father, your first degree relatives, your father or mother had heart problems, the chances of you having heart problems is slightly higher. So these are all genetic tendency to develop. Your cousin is a second generation or a second degree relative. Still, yes, second degree relatives also person. So essentially your parents or his parents may be the same thing. Siblings which can also have a second relative degrees relatives can also have genetic factors going down. So I would rather recommend, if you have any suspicion, always please check it out. I think it's everything nowadays. Things are so easy for you to check things. It's not like you need to go too far away to find. You just need to find the time and go and see and have it done.
Doctor, along with this question, I have another question. At what age should one start getting their heart health checked?
That's an interesting question. I still remember the first time when I came to India, I used to say 40, 45 and all. Now, once I started practicing and seeing more and more patients coming in 30s and 35s, the goalposts have changed to the goal. How we said, well, what I said in those days was completely different from what I'm saying now. That's purely because of my experience of seeing these youngsters coming with heart disease. So I've changed my levels by saying that if you're in your 30s and if you have a family history or any stroke risk factors like smoking or cholesterol, you please start checking your health from 30s. I used to say 40s, but definitely I've come down 10 years now. Now, how frequently do? That's the second question people tend to ask. How frequently do? Well, if you are perfectly normal, all the tests just come back as normal. Yeah, if you're in very young age, like 30s, 32, you can wait for another 2 years, 3 years. But if you are in your more than 40 years of age, I would strongly recommend you do on an annual basis. And if you have a strong family history of certain disorders, I think you may even need to start at 27, 28. I mean, I have seen patients with 26, 27 coming with heart attack. So it's not a real cutoff, but I think it just to give you an idea, that is probably. But if you have some strong risk factors, you do smoke, or if you have high cholesterol, a little bit more earlier than that.
Matches with our topic for the day. Use your heart to know your heart.
Absolutely. I think use your think and do, which is the right thing for you.
We'll take one last question, Doctor. I'm concerned about my son who's dedicated to going to the gym. Given the number of reported heart attack incidents occurring at the gym, I'd like to understand the reason behind these occurrences and learn how to prevent them.
Yeah. I think this has been creeping up in the last few months in social media everywhere. There are a lot of discussions about are gym goers having more heart attacks. I think that's a very common question. It's understandably people are panicked about certain things. Now let me put it in a perspective how you look at these things. So when you have somebody going to a shop and having a heart attack, that doesn't mean that people do have heart attacks in the shop. Doesn't mean you don't go to the shop. So essentially, what the basic concept I understand from speaking to many of these youngsters is one of the things they feel is when you go to the gym, they think that everything is perfect because they're going to the gym. I think that concept should come out. Just because somebody is going to the gym on a daily basis doesn't mean that everything is perfect. So what does that mean? So for example, youngsters, most of the time you see when they go to the gym is purely for muscle building. So if you're going for muscle building, you're not doing any cardio exercises, very less amount of cardio exercise. But if you are someone who have a very strong tendency in your family, have a high cholesterol and genetic factors for heart disease, and you never checked your cholesterol, you never checked your blood pressure, these are the risk factors. And if you start doing a strenuous exercise when your blood pressure is not under control, then of course there is always a risk. So my message to all people is just because you do physical activity, just because you go to the gym on a regular basis, please don't have a misconception that I will never have a heart problem. So because heart problems hit it in a different ways, in the different families, in different circumstances. So for example, if someone has a very low tendency to have a high cholesterol, and if they go to the gym, they can do 20 minutes, 30 minutes of cardio is enough for them. But at the same time, if you have another person who may be very fit, but they have a very strong family genetic history of many patients having high cholesterol in their grandparents and parents, they probably need a longer period of time cardio than that. So we not everybody fits in the same basket. So different people are different. So my point is, make sure you check your cholesterol. Again, coming to the same point, use heart, know heart. You need to know your heart before you say that this is enough for me. This may not be enough for you, but that may be enough for the other person. So so knowing your heart is the most important thing. And I think by knowing that, you can just focus your, say for example, you need more cardio, less. If you have everything perfect, you more muscle building, less cardio. It's a combination of things. So I think that is where the lack is. People should not just think that I am fit because I go to the gym on a daily basis. And of course, then the next comes to, what about taking steroids, for example? There are people who are more commonly taking some of these products to help them. And you need to be really focusing on understanding and getting a medical help before you do all these things, because indirectly that can damage your blood vessels as well. And these are the things we need to also look into, apart from the cholesterol and those things.
Which is a risk factor that nobody other than an expert or a
Correct.
cardiologist or
Yeah.
your physician might help you
So
with.
this is very common practice. The trainers and everybody suddenly says, "Oh, you can just take this; it'll build up quickly," and those things. So you need to be very careful in those things as well.
So, what would be your advice for our viewers today to maintain a healthy heart as we age, doctor?
Now, I mean, as we said, the motto of this year's is use heart, know heart. So you probably need to know more, and that just taking sure that you take it in. If you go into the internet and the media and the Instagram, or like WhatsApp, the media, universities come, so much of messages. Please don't get confused by the too many messages going around in different aspects of heart health. If you are in doubt, speak to an expert. There are experts in doing all these things. It's not that just randomly people coming out and putting 2 minutes reels and 2 minutes is not the answer to all the questions. There are experts sitting there knowing everything and reading papers, reading research papers and doing everything. So just don't fall for these gimmicks and all. So you probably spend a little bit more time knowing your heart rather than just falling on these small reels and non-experts giving opinions and ideas about how to look after your heart, how to treat your heart. I think to the same extent that there are people talking about what should you do on a heart attack, when you heart attack. Of course, that's not something except an expert can talk about. So don't fall for this, but you just keep yourself open-minded, but at the same time, you do your thorough research and analysis and speak to an expert, maybe visit an expert to decide on that as well.
Doctor, speaking of relying on expert information, what are the significant achievements or advancements today in treating heart conditions, doctor?
Absolutely. I think that is coming to the next level of how knowing the heart is one thing, but knowing your heart problem and getting the right help is the next way of going about.
And at the right time.
That's right. Yeah. So essentially, when we talk about there are this cardiology, I mean the heart ailments and the management of heart disease has changed dramatically in the last 10 years. I think there's a huge, tremendous advances in the way we treat heart diseases compared to a few years ago. So the first and foremost we can talk about is we moved from open surgeries to keyhole to now pinhole. Most of the time we can do most of your heart diseases can be treated. Most of the heart diseases can be treated by pinhole procedures, which are very tiny, small needle type incisions to open up and do everything. So for example, it could be either stents putting inside your heart or changing your valves. There are procedures like TAVI where you change the valve without even opening your chest, or that leakages valve can be fixed by what we call a small clip, mitral clip can do that. And the latest development in the last few years has been in the blood pressure management. So what we do is when patients have uncontrolled blood pressure for many years with different drugs, there are technologies available now. We just go and do an ablation procedure in certain parts of the blood vessels in the kidney that can actually bring your blood pressure decently down, I mean reasonably down, so that you can reduce your number of things. And one of the things we also understood it. Like yesterday, for example, somebody had a electrical wiring problem who needed a pacemaker. So those days we used to only those pacemakers to put under the skin and put two wires into the heart and connect it, wait for 5 days, 7 days for the wound to heal. Now there are technologies, we don't even need to do any incisions. We can directly go through the groin and directly put a small USB type 2 grams capsule into your heart, which can act as a pacemaker. There's no scars, nothing like that. The patient can discharge the next day. We in fact did this yesterday. So there are dramatic developments in technology. You need to find the right people, right hospital to all know all these things as well.
Thank you very much, doctor, for helping us recognize the heart disease risk, maintaining a healthy heart, as well as explaining the latest innovations in heart treatments today. For appointments with Dr. Refai Showkathali, Senior Consultant Interventional Cardiologist at Apollo Hospitals, Greams Road, Chennai, please contact 044 4040 1066. I repeat, 4040 1066. Thank you very much, doctor.
Thank you.
Thank you, viewers.